Question 1. Analysis of a new mother expressing discomfort and difficulty achieving a good latch while attempting to breastfeed her newborn. She has tried the cradle hold as demonstrated in a general class, but reports pain in her arm and shoulder, and the baby seems to be fussing and pulling away. The lactation educator needs to guide her towards a more effective and comfortable feeding position. Which of the following represents the most appropriate course of action? Option A. Suggest the mother try the side-lying hold, explaining how it can promote relaxation for both her and the baby and allow for a deeper latch, while also demonstrating how to adjust pillows for optimal support and comfort. Option B. Tell the mother that her discomfort is likely due to improper technique and that she should focus on perfecting the cradle hold before exploring other positions. Option C. Recommend the football hold, emphasizing its benefits for mothers recovering from a cesarean section, without inquiring further about the mother's specific discomfort or the baby's latch issues. Option D. Advise the mother to continue practicing the cradle hold, as it is the most common and widely taught position, and encourage her to push through the discomfort until she gets used to it. The correct answer is A. Suggest the mother try the side-lying hold, explaining how it can promote relaxation for both her and the baby and allow for a deeper latch, while also demonstrating how to adjust pillows for optimal support and comfort. Explanation. This scenario presents a common challenge for lactation educators, adapting advice to individual client needs and circumstances. The professional challenge lies in recognizing that, while certain breastfeeding holds are generally recommended, their suitability is highly dependent on the mother's physical comfort, the baby's latch, and the specific feeding environment. Careful judgment is required to avoid a one-size-fits-all approach and instead empower the mother to find what works best for her and her baby. The correct approach represents best professional practice because it prioritizes the mother's comfort and the baby's effective latch, which are foundational to successful breastfeeding. This aligns with the ethical principle of beneficence, ensuring the client receives care that promotes their well-being and that of their infant. It also reflects the professional standard of individualized care, acknowledging that each breastfeeding diet is unique. Furthermore, by offering a range of options and guiding the mother to assess effectiveness, the educator fosters her autonomy and confidence. An incorrect approach that focuses solely on one specific hold, without considering the mother's feedback or the baby's latch, fails to meet the standard of individualized care. This could lead to discomfort, frustration, and potentially hinder the breastfeeding journey, violating the principle of non-maleficence. Another incorrect approach that dismisses the mother's expressed discomfort without offering alternatives or further assessment demonstrates a lack of empathy and a failure to actively listen, which are crucial ethical components of client care. A third incorrect approach that rigidly insists on a particular hold, even when it is clearly not working, can undermine the mother's confidence and her ability to trust her own instincts and the educator's guidance. Professionals should employ a decision-making framework that begins with active listening to the client's concerns and observations. This is followed by a thorough assessment of the baby's latch and the mother's positioning and comfort. Based on this assessment, the educator can then introduce and demonstrate appropriate holds, explaining the rationale behind each. Crucially, the process involves ongoing feedback from the mother and observation of the baby's feeding cues to collaboratively determine the most effective and comfortable hold for the dyad. This iterative process ensures that the advice provided is practical, supportive, and tailored to the client's unique situation. Question 2. The control framework reveals that a new parent expresses concern to a certified lactation educator, CLE, that their infant, who is 2 weeks old, does not seem to be gaining weight adequately, and they are worried that their breast milk might not be rich enough anymore. The parent recalls hearing that milk composition changes after the initial colostrum phase. How should the CLE best respond to this parent's concern, considering the dynamic nature of milk composition and the CLE's scope of practice? Option A. Advise the parent that if the baby isn't gaining weight, they should immediately start supplementing with formula and suggest specific dietary changes for the mother to increase the fat content of her milk. Option B. Explain that breast milk naturally transitions from colostrum to mature milk, which has a different balance of fats and carbohydrates, and that these changes are normal and support infant growth. Reassure the parent that this is a typical developmental stage for breast milk and recommend they consult with their pediatrician or healthcare provider for a professional assessment of the infant's weight gain and overall health. Option C. Tell the parent not to worry, as breast milk is always perfect for babies, and that any perceived weight gain issues are likely due to the baby's activity level and that no further action is needed. Option D. Inform the parent that the baby's weight gain is directly related to the specific fat content of their mature milk at this exact moment, and that they should track the baby's feeding times and volumes meticulously to determine if the milk is indeed insufficient. The correct answer is B. Explain that breast milk naturally transitions from colostrum to mature milk, which has a different balance of fats and carbohydrates, and that these changes are normal and support infant growth. Reassure the parent that this is a typical developmental stage for breast milk, and recommend they consult with their pediatrician or healthcare provider for a professional assessment of the infant's weight gain and overall health. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the educator to synthesize knowledge about the dynamic nature of breast milk composition with the immediate needs and concerns of a new parent. The parent's anxiety about their baby's perceived lack of weight gain, coupled with their reliance on the educator's expertise, necessitates a response that is both scientifically accurate and emotionally supportive, while strictly adhering to the established scope of practice for a certified lactation educator, CLE. Misinformation or overstepping professional boundaries could lead to unnecessary stress for the parent, potentially impacting their feeding journey and the infant's well-being. Correct approach analysis. The correct approach demonstrates best professional practice by acknowledging the parent's concern, providing accurate information about the natural changes in milk composition over time, specifically the shift from colostrum to mature milk and its varying fat and carbohydrate content, and reassuring them that these changes are normal and beneficial for infant growth. Crucially, it also includes the vital step of recommending consultation with a healthcare provider for a comprehensive assessment of the infant's growth and feeding, which is within the CLE's scope of practice to suggest, but not to diagnose or manage medical concerns. This approach upholds ethical principles of beneficence, acting in the client's best interest, and non-maleficence, avoiding harm, by providing accurate information and guiding the parent toward appropriate medical evaluation without overstepping professional boundaries. Incorrect approaches analysis. One incorrect approach fails by directly attributing the baby's perceived lack of weight gain to a specific change in milk composition without a medical assessment. This constitutes a diagnostic overreach, as a CLE is not qualified to diagnose medical conditions or growth issues. It also risks providing inaccurate information if the weight gain issue stems from other factors, leading to undue parental anxiety and potentially delaying appropriate medical intervention. This violates the ethical principle of competence and the regulatory framework's emphasis on operating within the defined scope of practice. Another incorrect approach is to dismiss the parent's concern outright without providing any relevant educational information about milk composition changes. This demonstrates a lack of empathy and fails to address the parent's underlying anxiety, potentially eroding trust. While avoiding diagnosis, it neglects the educational role of a CLE and could leave the parent feeling unheard and unsupported, which is ethically problematic and fails to meet the professional standard of care. A third incorrect approach involves recommending specific dietary changes for the mother to alter milk composition without a medical referral. This is a significant overstep of the CLE's scope of practice. Nutritional advice related to milk production or composition that impacts infant growth should only be provided by qualified healthcare professionals, such as registered dietitians or physicians. A CLE recommending such interventions could lead to inappropriate or even harmful dietary practices for the mother and fail to address the root cause of the infant's growth concerns, representing a clear regulatory and ethical failure. Professional reasoning. Professionals should approach such situations by first actively listening to and validating the parent's concerns. They should then access their knowledge base regarding the topic, milk composition changes, and frame it in a way that is understandable and reassuring to the parent. The critical next step is to identify the boundaries of their professional role. When concerns extend beyond education and into medical assessment or diagnosis, the professional must ethically and effectively refer the client to the appropriate healthcare provider. This decision-making process prioritizes client safety, adherence to regulatory guidelines, and the maintenance of professional integrity. Question 3. Cost-benefit analysis shows that providing comprehensive education on the physiological changes in breast tissue during pregnancy and lactation is a highly effective use of a certified lactation educator's time. Which of the following educational approaches best supports this finding by promoting client understanding and preparedness? Option A. Sharing personal anecdotes about how one's own breasts change during pregnancy and lactation to help the client feel more relatable. Option B. Suggesting that significant changes in breast tissue are a sign of potential problems and advising the client to consult a physician immediately for any perceived alterations. Option C. Focusing primarily on the aesthetic changes in the breasts, such as stretch marks and darkening of the areola, as these are often the most visible and concerning to clients. Option D. Explaining the hormonal influences on glandular development and ductal proliferation, and how these changes prepare the breast for milk production and removal, while also addressing common concerns about changes in size, shape, and nipple sensitivity. The correct answer is D. Explaining the hormonal influences on glandular development and ductal proliferation, and how these changes prepare the breast for milk production and removal, while also addressing common concerns about changes in size, shape, and nipple sensitivity. Explanation. This scenario is professionally challenging because it requires the certified lactation educator CLE to provide accurate, evidence-based information about physiological changes in breast tissue during pregnancy and lactation, while also navigating potential client anxieties or misconceptions. The CLE must rely on established, scientifically validated knowledge and avoid offering personal opinions or unverified information. The correct approach represents best professional practice because it aligns with the core ethical and professional responsibilities of a CLE. This includes providing accurate education based on current scientific understanding of mammary gland physiology, which is crucial for supporting clients effectively and safely. Adhering to established guidelines ensures that the information provided is reliable and promotes optimal maternal and infant health outcomes. An incorrect approach that relies on anecdotal evidence or personal experience would be a significant ethical failure. It misrepresents the nature of professional education, which is grounded in research and consensus, not individual anecdotes. This could lead to misinformation, potentially causing harm or distress to the client. Another incorrect approach, such as focusing solely on the aesthetic changes without addressing the functional implications, would be professionally inadequate. It fails to provide comprehensive education that empowers the client with the knowledge needed for successful lactation. Furthermore, an approach that dismisses or downplays the client's concerns about breast tissue changes would be ethically unsound, as it demonstrates a lack of empathy and fails to establish a trusting professional relationship. Professional decision-making in such situations requires a commitment to evidence-based practice, clear and empathetic communication, and a thorough understanding of the physiological processes involved. A CLE should always prioritize accurate, up-to-date information and tailor their communication to the client's specific needs and concerns, ensuring they feel heard and supported. Question 4. Research into factors affecting milk supply has identified several potential influences. A certified lactation educator, CLE, is consulting with a mother who expresses concern that her milk supply is low. Which of the following approaches best reflects a comprehensive and ethically sound initial assessment by the CLE? Option A. Inquire about the mother's perceived milk supply, the infant's feeding frequency and duration, and signs of adequate infant intake such as wet and dirty diapers and weight gain. Option B. Advise the mother that her feelings of low supply are likely due to normal hormonal fluctuations and that she should not worry unless the baby is visibly distressed. Option C. Focus exclusively on the mother's emotional state and suggest that stress is the primary cause of any perceived milk supply issues. Option D. Immediately recommend a specific herbal supplement known to promote milk production, as this is a common and effective solution. The correct answer is A. Inquire about the mother's perceived milk supply, the infant's feeding frequency and duration, and signs of adequate infant intake such as wet and dirty diapers and weight gain. Explanation. This scenario is professionally challenging because it requires the certified lactation educator, CLE, to navigate a complex interplay of physiological, psychological, and environmental factors that can impact milk supply. The CLE must apply their knowledge ethically and within the scope of their practice, recognizing when to provide support and when to refer to other healthcare professionals. Careful judgment is required to avoid making assumptions and to ensure evidence-based, client-centered care. The correct approach represents best professional practice because it prioritizes a comprehensive assessment of the mother's experience and the infant's feeding cues. This aligns with the ethical principles of beneficence and non-maleficence, ensuring the mother and infant receive appropriate and safe support. It also adheres to the professional guidelines for CLEs, which emphasize individualized care and the importance of understanding the holistic context of breastfeeding. By focusing on the mother's perceived supply, infant's intake, and feeding frequency, CLE is gathering crucial data to identify potential issues and tailor interventions effectively. An incorrect approach that focuses solely on the mother's subjective feeling of low supply, without further investigation, is ethically problematic. It risks oversimplifying a complex issue and could lead to unnecessary interventions or anxiety for the mother. This approach fails to uphold the principle of thorough assessment and could lead to a misdiagnosis of the problem, potentially delaying appropriate support or causing harm. Another incorrect approach that involves recommending specific supplements without a medical evaluation or referral to a healthcare provider oversteps the scope of practice for a CLE. This action could have unintended consequences for the mother's health or the infant's well-being and violates the ethical duty to practice within one's defined competencies and to refer when necessary. A third incorrect approach that dismisses the mother's concerns without a thorough assessment is a failure of empathy and professional responsibility. It disregards the mother's lived experience and can erode trust, hindering the establishment of a supportive relationship. This approach is ethically unsound as it does not prioritize the client's well-being or provide adequate support. The professional reasoning process for similar situations should involve a systematic approach. First, actively listen to the client's concerns and gather subjective information. Second, conduct a thorough objective assessment, observing feeding dynamics, infant cues, and maternal physical signs. Third, analyze the gathered information to identify potential contributing factors to milk supply concerns. Fourth, develop an individualized plan of care, which may include education, support, and appropriate referrals to healthcare professionals when indicated. Throughout this process, maintaining ethical boundaries and adhering to professional guidelines is paramount. Question 5. Risk assessment procedures indicate that a breastfeeding client expresses a strong preference for a very restrictive vegan diet, consuming primarily fruits and vegetables, and is concerned about potential deficiencies impacting her milk supply and her baby's development. As a certified lactation educator, CLE, what is the most appropriate course of action? Option A. Advise the client that her current diet is likely insufficient and strongly encourage her to immediately adopt a more varied diet that includes animal products to ensure adequate nutrition for herself and her baby. Option B. Inform the client that personal dietary choices are her own and that as a CLE, you cannot provide advice on nutrition, suggesting she consult a general practitioner for any concerns. Option C. Reassure the client that as long as she is consuming enough calories, her milk will be adequate, and focus solely on the emotional aspects of breastfeeding without addressing specific nutritional concerns. Option D. Educate the client on the essential macronutrient and micronutrient requirements for lactation, such as adequate protein, iron, vitamin B12, and omega-3 fatty acids, and discuss strategies for incorporating these nutrients into a vegan diet, potentially recommending consultation with a registered dietitian specializing in plant-based nutrition. Correct answer is D. Educate the client on the essential macronutrient and micronutrient requirements for lactation, such as adequate protein, iron, vitamin B12, and omega-3 fatty acids, and discuss strategies for incorporating these nutrients into a vegan diet, potentially recommending consultation with a registered dietitian specializing in plant-based nutrition. Explanation. The scenario presents a common challenge for certified lactation educators, CLE, where a client's personal dietary choices may conflict with established nutritional guidelines for lactation, potentially impacting infant health. The professional challenge lies in balancing respect for client autonomy with the ethical and professional responsibility to provide evidence-based information that supports optimal infant nutrition and maternal well-being. This requires a nuanced approach that avoids judgment, while ensuring the client receives accurate, actionable advice. The correct approach represents best professional practice because it prioritizes evidence-based information and client-centered education. By focusing on the established nutritional requirements for lactation, such as adequate calorie intake, hydration, and key micronutrients like folate and iron. The CLE provides essential guidance grounded in scientific consensus. This approach aligns with the ethical principles of beneficence, acting in the client's best interest, and non-maleficence, avoiding harm, by empowering the client with knowledge to make informed decisions that support healthy lactation and infant development. It respects the client's autonomy by offering information rather than dictating choices, fostering a collaborative relationship. An incorrect approach that dismisses the client's dietary choices without understanding their rationale or providing evidence-based alternatives fails to uphold the principle of beneficence. It risks alienating the client and may lead to the client disregarding important nutritional advice altogether. This approach could also be seen as judgmental, violating the ethical principle of respect for persons. Another incorrect approach that solely focuses on the client's personal beliefs without addressing the established nutritional needs for lactation fails to meet the professional standard of care. While cultural sensitivity is important, a CLE's primary role is to educate on nutritional requirements that directly impact milk production and infant health. Omitting this crucial information, even with good intentions, could inadvertently lead to suboptimal nutrition for the infant, thus violating the principle of non-maleficence. A professional decision-making process in such situations should begin with active listening to understand the client's current dietary habits and any underlying reasons for their choices. Next, the CLE should assess the client's knowledge regarding lactation nutrition. Following this, the CLE should present evidence-based information on the essential nutritional components of breast milk and the maternal dietary factors that influence them, using clear, non-judgmental language. Finally, the CLE should collaboratively explore practical strategies for the client to incorporate necessary nutrients into their existing diet, respecting their preferences and circumstances as much as possible, while always prioritizing the health and well-being of both mother and infant. Question 6. Governance review demonstrates that a certified lactation educator, CLE, is providing support to a new mother who expresses confusion about how her body produces and releases milk. The mother states, "I've heard that if I just think about my baby, the milk comes out, but I don't understand how that actually works or if it's the only thing that matters." The CLE needs to address this statement effectively to ensure the mother has a clear understanding of the underlying physiological mechanisms. Which of the following approaches best addresses the mother's statement and promotes effective lactation management? Option A. Reassure the mother that her intuitive understanding is sufficient and focus on practical latch techniques without delving into hormonal details. Option B. Explain that while emotional connection can influence milk release, the primary drivers are prolactin, which stimulates milk production, and oxytocin, which triggers the milk ejection reflex letdown. Option C. Acknowledge her statement about thinking of the baby, and then immediately shift the conversation to discussing potential challenges with milk supply and infant weight gain. Option D. Inform the mother that the hormonal mechanisms are too complex for new mothers to grasp, and that she should simply follow general breastfeeding advice. The correct answer is B. Explain that while emotional connection can influence milk release, the primary drivers are prolactin, which stimulates milk production, and oxytocin, which triggers the milk ejection reflex letdown. Explanation. This scenario presents a professional challenge because it requires a certified lactation educator, CLE, to navigate a situation where a client's understanding of hormonal influences on lactation is incomplete, potentially leading to ineffective or harmful practices. The CLE must provide accurate, evidence-based information that respects the client's autonomy while ensuring the safety and well-being of both mother and infant. The challenge lies in translating complex physiological processes into understandable terms and addressing potential misinformation without alienating the client. The correct approach represents best professional practice because it prioritizes client education and empowerment based on established physiological principles. By explaining the distinct roles of prolactin in milk production and oxytocin in milk ejection, the CLE directly addresses the client's misconception. This approach is ethically sound as it promotes informed decision-making and supports the client's ability to manage her lactation journey effectively. It aligns with the professional responsibility of a CLE to provide accurate, evidence-based guidance, fostering a supportive and trusting relationship. An incorrect approach that focuses solely on the client's perceived immediate need without addressing the underlying hormonal misunderstanding fails to provide comprehensive education. This could lead to continued ineffective latch techniques or reliance on unproven methods, potentially impacting milk supply and infant intake. Ethically, this is a failure to provide adequate information for informed consent and self-management. Another incorrect approach that dismisses the client's question as irrelevant or overly complex is professionally unacceptable. This demonstrates a lack of empathy and a failure to meet the client where she is in her understanding. It can erode trust and discourage the client from seeking further guidance, potentially leading to isolation and continued struggles. This violates the ethical principle of beneficence by not actively working to improve the client's situation. A further incorrect approach that offers generic advice without clarifying the hormonal mechanisms is insufficient. While well-intentioned, it does not equip the client with the specific knowledge needed to understand why certain actions are recommended or how her body is responding. This can lead to frustration if the generic advice doesn't yield the desired results, as the client lacks the foundational understanding to troubleshoot or adapt. This is a failure in the duty to educate and empower. The professional decision-making process for similar situations involves active listening to identify the client's specific concerns and knowledge gaps. The CLE should then assess the accuracy of the client's understanding and plan to provide clear, concise, and evidence-based information tailored to the client's level of comprehension. This involves explaining relevant physiological processes, such as the roles of prolactin and oxytocin, in a way that is easily understood. The CLE should also empower the client to ask questions and actively participate in her lactation management, fostering a collaborative approach to care. Question 7. Which approach would be most appropriate for a certified lactation educator CLE when a client expresses concern about insufficient milk production, focusing on the hormonal regulation of lactation? Option A. Educate the client on the roles of prolactin and oxytocin in milk production and release, explaining how infant feeding cues and frequent nursing can stimulate these hormones, and advise consulting with a healthcare provider for further assessment if concerns persist. Option B. Focus on teaching the client relaxation techniques and stress management, assuming that all milk supply issues are solely psychosomatic and can be resolved through non-physiological means. Option C. Diagnose the client with a specific hormonal imbalance causing low milk supply and prescribe a course of action to correct it, without involving other healthcare professionals. Option D. Provide a detailed treatment plan for the client, including specific dosages of herbal galactagogues and recommendations for prescription medications to increase milk supply, based on common anecdotal reports. The correct answer is A. Educate the client on the roles of prolactin and oxytocin in milk production and release, explaining how infant feeding cues and frequent nursing can stimulate these hormones, and advise consulting with a healthcare provider for further assessment if concerns persist. Explanation. This scenario presents a common challenge for a certified lactation educator CLE, where a client is experiencing difficulties with milk supply, a situation directly impacted by hormonal regulation. The professional challenge lies in providing accurate, evidence-based information that empowers the client while respecting the scope of practice for a CLE. It requires careful judgment to differentiate between providing educational support and offering medical advice, which falls outside the CLE's purview. The correct approach represents best professional practice because it focuses on educating the client about the physiological mechanisms of lactation, specifically the hormonal feedback loops involving prolactin and oxytocin, and how these can be influenced by infant behavior and maternal well-being. This aligns with the CLE's role as an educator, providing foundational knowledge to help the client understand their body's processes. It empowers the client to work collaboratively with healthcare providers by equipping them with informed questions and a better understanding of potential interventions. This approach is ethically sound, as it respects the client's autonomy and avoids overstepping professional boundaries. It is also consistent with the general principles of client education in health professions, emphasizing understanding and informed decision-making. An incorrect approach that involves diagnosing the cause of low milk supply and recommending specific pharmaceutical interventions or complex medical management fails to adhere to the CLE's scope of practice. This constitutes a regulatory and ethical failure, because it ventures into medical diagnosis and treatment, which requires the expertise of a licensed healthcare professional such as a physician or advanced practice nurse. Such an approach could lead to inappropriate or harmful interventions if the underlying cause is not accurately identified by a qualified medical practitioner. It also undermines the client's trust in the healthcare system by providing information outside the educator's authorized role. Another incorrect approach that focuses solely on anecdotal remedies or unverified natural solutions without grounding them in physiological understanding or recommending consultation with healthcare providers is also professionally unacceptable. This is an ethical failure as it may lead the client to delay seeking appropriate medical evaluation and treatment, potentially exacerbating their condition. It also fails to provide evidence-based education, which is a cornerstone of professional practice. The professional decision-making process for similar situations should involve a clear understanding of the CLE's scope of practice, which is primarily education and support. When faced with a client concern that touches upon medical diagnosis or treatment, the professional should first acknowledge the client's concern and then pivot to providing relevant, evidence-based educational information within their scope. If the concern clearly falls outside the CLE's expertise, the professional decision-making process must include a clear and direct referral to appropriate healthcare professionals, such as a physician, pediatrician, or a registered dietitian, while explaining the rationale for the referral based on the need for medical assessment or intervention. This ensures the client receives comprehensive and appropriate care. Question 8. The review process indicates that a new mother reports her baby seems very interested in feeding, latches on well, and sucks vigorously for most of the feeding. However, the baby has had fewer wet diapers than expected for their age, and the mother is concerned about milk supply. As a certified lactation educator, CLE, what is the most crucial observation to make to determine if breastfeeding is truly effective? Option A. Confirming the infant's weight gain trend over the past week. Option B. Listening for audible swallowing sounds throughout the feeding and observing the infant's jaw movements. Option C. Observing the infant's rooting reflex and their ability to find the nipple. Option D. Assessing the mother's comfort level and the duration of each feeding session. The correct answer is B. Listening for audible swallowing sounds throughout the feeding and observing the infant's jaw movements. Explanation. The review process indicates a common challenge faced by certified lactation educators, CLE, when assessing breastfeeding effectiveness, distinguishing between a baby's active participation and passive feeding. Parents may observe their infant rooting, latching, and sucking, leading them to believe breastfeeding is going well, when in reality, the infant may not be effectively transferring milk. This can lead to inadequate milk intake, poor weight gain, and maternal discomfort, all of which can jeopardize the breastfeeding journey. A CLE's role is to go beyond superficial observations and assess the physiological signs of effective milk transfer, ensuring both infant and maternal well-being are supported according to established best practices for lactation support. The correct approach represents best professional practice because it prioritizes objective, observable signs of effective milk transfer, which are directly correlated with adequate infant nutrition and maternal milk production. This aligns with the ethical responsibility of a CLE to provide evidence-based guidance that promotes infant health and supports the parent's breastfeeding goals. By focusing on audible swallowing, visible jaw movement, and the infant's behavior post-feed, the CLE is assessing the core indicators of successful milk transfer, thereby preventing potential complications arising from ineffective feeding. An incorrect approach that relies solely on the infant's apparent engagement without verifying milk transfer is a failure to meet the standard of care for a CLE. This oversight can lead to a false sense of security for the parent, delaying necessary interventions and potentially causing harm to the infant through insufficient caloric intake and dehydration. Ethically, this constitutes a failure to adequately assess and address the infant's nutritional needs. Another incorrect approach that focuses only on the mother's comfort without assessing the infant's intake is also problematic. While maternal comfort is important, it does not guarantee the infant is receiving adequate nourishment, which is the primary goal of breastfeeding. This approach neglects the infant's well-being and the fundamental purpose of lactation. Professionals should employ a systematic assessment process that includes observing the infant's latch, listening for swallowing, noting the pattern of sucking and swallowing, and assessing the infant's behavior and output after a feeding. This multifaceted approach ensures a comprehensive understanding of breastfeeding effectiveness, allowing for timely and appropriate interventions when needed. Question 9. The analysis reveals that a new mother is preparing to return to work and is asking for advice on how to store expressed breast milk for her infant. She mentions she has a small refrigerator at her workplace and is unsure about how long she can leave milk at room temperature before refrigerating it, expressing concern about the milk spoiling before she can get it home. She also asks if it's okay to top off a bottle of previously expressed milk with fresh milk. Option A. Inform the mother that refrigeration at work is unnecessary and she can store expressed milk in a clean container at room temperature for the entire workday, and that topping off bottles is a good way to consolidate milk. Option B. Suggest that the mother store all expressed milk in a cooler bag with ice packs and bring it home immediately, and advise her to top off existing bottles with fresh milk to avoid waste. Option C. Tell the mother that as long as the milk looks and smells fine, she can leave it at room temperature for several hours, and that topping off bottles is generally acceptable if done quickly. Option D. Advise the mother on the recommended maximum time breast milk can be safely stored at room temperature, in the refrigerator, and in the freezer, and explain that topping off a bottle of previously expressed milk with fresh milk is not recommended due to potential bacterial growth. The correct answer is D. Advise the mother on the recommended maximum time breast milk can be safely stored at room temperature, in the refrigerator, and in the freezer, and explain that topping off a bottle of previously expressed milk with fresh milk is not recommended due to potential bacterial growth. Explanation. This scenario presents a professional challenge because it requires balancing a parent's immediate need for information and convenience with the critical importance of safe breast milk storage practices to protect infant health. The Certified Lactation Educator, CLE, must navigate potential parental pressure and misinformation while upholding evidence-based guidelines. The correct approach represents best professional practice because it prioritizes infant safety and adheres to established public health recommendations for breast milk storage. By providing accurate, evidence-based information on proper storage durations and conditions, the CLE ensures the parent can make informed decisions that minimize the risk of bacterial contamination and nutrient degradation, thereby safeguarding the infant's well-being. This aligns with the ethical obligation of a CLE to provide accurate and safe guidance. An incorrect approach that suggests storing milk at room temperature for extended periods without considering specific timeframes or environmental factors is professionally unacceptable. This fails to adhere to public health guidelines, increasing the risk of bacterial growth and spoilage, which can lead to infant illness. It also demonstrates a lack of professional diligence in providing accurate information. Another incorrect approach that relies solely on the parent's subjective assessment of milk freshness without providing objective storage guidelines is also problematic. This abdicates the CLE's responsibility to educate and inform, potentially leading to unsafe practices. Finally, an approach that dismisses the importance of storage guidelines due to the parent's perceived busy schedule fails to acknowledge the non-negotiable nature of infant safety and the potential consequences of compromised breast milk. The professional decision-making process for similar situations involves first identifying the core concern, infant safety and nutrition. Next, the CLE should access and apply current, evidence-based guidelines from reputable public health organizations. The information should then be communicated clearly and empathetically to the parent, addressing their specific concerns while reinforcing the rationale behind the recommendations. If a parent expresses resistance or misunderstanding, the CLE should patiently re-explain the guidelines and their importance, offering practical solutions where possible without compromising safety. Question 10. The monitoring system demonstrates that a lactating mother reports feeling fatigued and expresses concern about her milk supply. The Certified Lactation Educator, CLE, is reviewing the mother's self-reported dietary intake, which includes a variety of foods but lacks specific details on portion sizes and meal timing. Which of the following approaches best reflects best practice for assessing and addressing the mother's nutritional needs to support lactation? Option A. Engage in a detailed discussion about the mother's typical daily food and fluid intake, focusing on nutrient-dense food choices and adequate hydration, and provide evidence-based recommendations for incorporating a wider variety of fruits, vegetables, lean proteins, and whole grains, while also exploring potential barriers to optimal nutrition. Option B. Advise the mother to follow a standardized meal plan for lactating women, emphasizing strict adherence to calorie and macronutrient targets, as this is the most effective way to manage fatigue and optimize milk production. Option C. Focus on identifying specific food groups the mother is avoiding and suggest replacing them with commercially available lactation-enhancing snacks, as these are designed to boost milk supply and energy levels. Option D. Immediately recommend a multivitamin and mineral supplement, specifically formulated for lactating women to ensure adequate nutrient intake, as fatigue and concerns about milk supply often indicate a deficiency. The correct answer is A. Engage in a detailed discussion about the mother's typical daily food and fluid intake, focusing on nutrient-dense food choices and adequate hydration, and provide evidence-based recommendations for incorporating a wider variety of fruits, vegetables, lean proteins, and whole grains, while also exploring potential barriers to optimal nutrition. Explanation: this scenario is professionally challenging because it requires the Certified Lactation Educator (CLE) to evaluate the effectiveness of a mother's nutritional intake in supporting lactation, a process influenced by numerous individual factors. The CLE must balance providing evidence-based guidance with respecting the mother's autonomy and cultural practices. Careful judgment is required to identify potential nutritional gaps without causing undue stress or promoting restrictive diets. The correct approach represents best professional practice because it prioritizes a holistic and individualized assessment. It acknowledges that a mother's diet is complex and influenced by various factors beyond simple calorie counting. By focusing on the mother's reported intake, energy levels, and hydration, and then offering evidence-based, culturally sensitive recommendations for nutrient-dense foods, the CLE is adhering to the principles of client-centered care and promoting optimal maternal and infant health. This aligns with the ethical guidelines of the CLE certification, which emphasize providing accurate, unbiased information and supporting informed decision-making. An incorrect approach that focuses solely on macronutrient ratios without considering the mother's overall well-being or dietary preferences fails to recognize the multifaceted nature of nutrition for lactating mothers. This could lead to an overly rigid and potentially unsustainable dietary plan, causing stress and potentially impacting milk supply negatively. Ethically, it disregards the individual needs and context of the mother. Another incorrect approach that relies on generalized dietary guidelines without assessing the mother's current intake or concerns is insufficient. While general guidelines are a starting point, they do not account for individual variations in metabolism, activity levels, or specific dietary needs during lactation. This approach lacks the personalized assessment crucial for effective lactation support and could lead to missed opportunities for targeted intervention. A further incorrect approach that immediately suggests supplements without a thorough dietary assessment is premature and potentially unnecessary. Supplements should be considered when dietary intake is demonstrably insufficient and cannot be adequately addressed through food. Recommending supplements without understanding the mother's current diet and identifying specific nutrient deficiencies is not best practice and could lead to oversupplementation or unnecessary expense. Professionals should approach such situations by first actively listening to the mother's concerns and reported experiences. Then conduct a comprehensive, non-judgmental assessment of her current dietary intake, hydration, energy levels, and any perceived challenges. Based on this assessment, provide evidence-based, practical, and culturally appropriate recommendations, emphasizing nutrient-dense foods and adequate hydration. If specific deficiencies are suspected, further investigation or referral may be necessary. The decision-making process should always prioritize the mother's well-being, autonomy, and the successful establishment and maintenance of lactation. Question 11. Strategic planning requires a certified lactation educator (CLE) to effectively address a parent's concerns about infant immune system development, particularly when the parent expresses a strong preference for formula feeding based on anecdotal evidence, suggesting it offers superior immune benefits. How should the CLE best approach this situation to ensure the parent receives accurate, evidence-based information while respecting their autonomy? Option A. Agree with the parent's assessment of formula's immune benefits to avoid conflict and focus on other aspects of infant care, assuming the parent has thoroughly researched their decision. Option B. Acknowledge the parent's concerns. Provide evidence-based information on how breastfeeding supports immune development, address specific misconceptions about formula, and suggest consulting with a pediatrician to discuss feeding options and the infant's overall health. Option C. Immediately counter the parent's claims by stating that formula is inferior for immune development and strongly advocate for exclusive breastfeeding without further discussion of the parent's reasoning. Option D. Provide general information about the benefits of all infant feeding methods without directly addressing the parent's specific concerns about immune development and formula. The correct answer is B. Acknowledge the parent's concerns, provide evidence-based information on how breastfeeding supports immune development, address specific misconceptions about formula, and suggest consulting with a pediatrician to discuss feeding options and the infant's overall health. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a certified lactation educator, CLE, to navigate a parent's deeply held, albeit misinformed, beliefs about infant feeding and its impact on immune development. The parent's reliance on anecdotal evidence and a misunderstanding of scientific principles creates a barrier to evidence-based education. The CLE must balance providing accurate information with maintaining a supportive and non-judgmental relationship, which is crucial for effective client care and adherence to professional ethical guidelines. The potential for the parent to make decisions detrimental to the infant's health due to misinformation adds a layer of urgency and responsibility. Correct approach analysis. The correct approach involves a multifaceted strategy that prioritizes education, empathy, and collaboration. This aligns with the ethical responsibilities of a CLE to promote infant health and well-being through accurate information dissemination. Specifically, it involves 1. Acknowledging and validating the parent's concerns and experiences without necessarily agreeing with their conclusions. This builds trust and rapport. 2. Providing clear, evidence-based information about how breastfeeding, particularly colostrum and breast milk, contributes to the infant's immune system development. This should include discussing the transfer of antibodies and beneficial microbes. 3. Addressing the parent's specific misconceptions about formula feeding and immune development, explaining the differences in immunological components. 4. Collaborating with the parent to develop a feeding plan that supports the infant's health, potentially exploring ways to incorporate breastfeeding or expressed milk if exclusive formula feeding is chosen for other reasons, while still respecting their ultimate decision. 5. Recommending consultation with a pediatrician or other healthcare provider to ensure comprehensive medical advice is received. This is a critical step in ensuring the infant's overall health and safety, and it also serves to reinforce the CLE's role as an educator and supporter, not a sole medical advisor. This approach upholds the CLE's commitment to evidence-based practice and client-centered care, ensuring the parent is empowered with accurate knowledge to make informed decisions for their child. Incorrect approaches analysis. One incorrect approach would be to dismiss the parent's concerns outright and insist on breastfeeding without further discussion or understanding of their reasoning. This is ethically problematic as it fails to respect the parent's autonomy and can alienate them, making them less receptive to any advice. It also neglects the importance of understanding the parent's perspective, which is a cornerstone of effective client support. Another incorrect approach would be to provide only general information about the benefits of breastfeeding without directly addressing the parent's specific concerns about formula and immune development. This fails to meet the parent where they are and does not effectively counter their misinformation. It also misses an opportunity to build trust by directly engaging with their expressed worries. A third incorrect approach would be to agree with the parent's misconceptions to avoid conflict. This is a severe ethical failure, as it prioritizes superficial harmony over the infant's health and well-being. A CLE has a professional obligation to provide accurate information, even when it may be challenging for the parent to hear. Failing to do so constitutes a dereliction of duty and could lead to harmful decisions. Professional reasoning. When faced with a situation where a parent holds misinformation that could impact their infant's health, a CLE should employ a problem-solving process that involves active listening, empathetic communication, evidence-based education, and collaborative decision-making. The process begins with understanding the parent's perspective and concerns. Next, the CLE must clearly and compassionately present accurate, scientific information relevant to the parent's concerns, focusing on the specific topic of immune system development. This should be followed by an open dialogue where the parent's questions are answered and their understanding is assessed. Finally, the CLE should work with the parent to create a plan that prioritizes the infant's health, involving other healthcare professionals as necessary. This systematic approach ensures that the parent feels heard and respected, while also receiving the critical information needed to make the best decisions for their child. Question 12. During the evaluation of a new mother who expresses a desire to supplement her breastfed newborn with formula from the beginning, citing concerns about her milk supply and wanting to ensure the baby is full, what is the most appropriate initial course of action for a certified lactation educator CLE? Option A. Discuss the benefits of exclusive breastfeeding, explore the mother's specific concerns about milk supply and infant fullness, and collaboratively develop strategies to support adequate milk production and assess infant intake. Option B. Advise the mother that exclusive breastfeeding is the only recommended feeding method and strongly discourage any form of supplementation. Option C. Suggest that the mother try exclusively formula feeding for a few days to rest her milk supply before attempting to breastfeed again. Option D. Immediately recommend a specific brand of infant formula and provide instructions on how to administer it alongside breastfeeding. The correct answer is A. Discuss the benefits of exclusive breastfeeding, explore the mother's specific concerns about milk supply and infant fullness, and collaboratively develop strategies to support adequate milk production and assess infant intake. Explanation. This scenario presents a common and professionally challenging situation for a certified lactation educator CLE. The challenge lies in balancing the mother's stated preference and perceived ease with evidence-based best practices for infant feeding and the promotion of exclusive breastfeeding, while also respecting the mother's autonomy and building trust. The CLE must navigate potential misinformation or a lack of understanding regarding the benefits of exclusive breastfeeding and the risks associated with supplementation. The correct approach represents best professional practice because it prioritizes education and support for exclusive breastfeeding, aligning with established guidelines for infant nutrition and health. By offering a comprehensive discussion about the benefits of exclusive breastfeeding, exploring the reasons behind the mother's desire for supplementation, and collaboratively developing a plan to address those concerns, the CLE upholds the ethical responsibility to promote optimal infant health and support the mother's breastfeeding journey. This approach empowers the mother with accurate information and practical strategies, fostering her confidence and ability to achieve her breastfeeding goals. It also adheres to the ethical principle of beneficence, acting in the best interest of both mother and infant. An incorrect approach that immediately agrees to supplementation without further exploration fails to adequately educate the mother on the potential downsides of unnecessary supplementation, such as decreased milk supply, nipple confusion, and reduced infant exposure to beneficial colostrum and breast milk. This could be considered a failure to uphold the duty of care and to provide comprehensive lactation support. Another incorrect approach that dismisses the mother's concerns or pressures her to exclusively breastfeed without addressing her underlying anxieties or perceived difficulties could lead to feelings of invalidation, frustration, and a breakdown in the professional relationship. This could result in the mother feeling unsupported and potentially abandoning breastfeeding altogether, which is contrary to the CLE's role. A third incorrect approach that suggests a specific formula without a thorough assessment of the mother's breastfeeding status and the infant's needs, or without exploring all possible breastfeeding solutions first, may not be in the best interest of the infant and could undermine the mother's breastfeeding efforts. The professional decision-making process for similar situations involves active listening to the mother's concerns, conducting a thorough assessment of the breastfeeding diet, providing evidence-based education tailored to the mother's understanding, collaboratively problem-solving to address identified challenges, and offering ongoing support. It requires a non-judgmental and empathetic approach that respects the mother's autonomy while guiding her towards decisions that promote the health and well-being of both mother and infant. Question 13. Benchmark analysis indicates that certified lactation educators, CLE, play a crucial role in maternal and infant health. Considering the long-term implications of early life nutrition, which approach best reflects a CLE's responsibility in reducing the risk of chronic diseases for both mother and child? Option A. Providing specific dietary plans for mothers and infants designed to prevent future chronic illnesses, based on general nutritional guidelines. Option B. Focusing exclusively on immediate breastfeeding techniques and troubleshooting common latch issues, as the long-term health impacts are outside the scope of lactation education. Option C. Educating families about the established scientific evidence linking breastfeeding to a lower incidence of chronic conditions such as obesity, type 2 diabetes, and cardiovascular disease in later life, and empowering them with this knowledge to support their feeding choices. Option D. advising families on the genetic predisposition to chronic diseases, and suggesting that breastfeeding may or may not mitigate these risks depending on individual factors. The correct answer is C. Educating families about the established scientific evidence linking breastfeeding to a lower incidence of chronic conditions such as obesity, type 2 diabetes, and cardiovascular disease in later life, and empowering them with this knowledge to support their feeding choices. Explanation: this scenario presents a professional challenge because it requires a certified lactation educator, CLE, to navigate the complex interplay between evidence-based lactation support and the prevention of chronic diseases, a role that extends beyond immediate infant feeding. The CLE must understand how early life nutrition, specifically breastfeeding, can have long-term health implications for both the infant and the mother, and how to effectively communicate this to families. Careful judgment is required to ensure that advice is accurate, culturally sensitive, and aligned with public health goals without overstepping the scope of practice. The correct approach represents best professional practice because it directly addresses the CLE's role in promoting long-term health outcomes by educating families on the established link between breastfeeding and reduced risk of chronic diseases such as obesity, type 2 diabetes, and certain cardiovascular conditions. This aligns with public health recommendations and the ethical imperative to provide comprehensive support that benefits the family's well-being throughout their lives. By focusing on education and empowerment, the CLE facilitates informed decision-making, which is a cornerstone of ethical and effective lactation support. An incorrect approach that focuses solely on immediate feeding challenges without acknowledging the long-term health benefits fails to uphold the comprehensive role of a CLE in promoting lifelong health. This oversight can lead to missed opportunities for preventative health education, potentially impacting the family's future health trajectory. Ethically, it represents a failure to provide complete information that could significantly benefit the client. Another incorrect approach that overemphasizes the CLE's role in diagnosing, treating chronic diseases in infants or mothers would be a significant regulatory and ethical failure. A CLE's scope of practice is focused on lactation support and education, not medical diagnosis or treatment. Recommending specific medical interventions or making definitive pronouncements about disease risk without appropriate medical consultation would violate professional boundaries and potentially endanger the client. A further incorrect approach that dismisses the role of breastfeeding in chronic disease prevention due to anecdotal evidence or personal beliefs would be a failure to adhere to evidence-based practice. This undermines the credibility of the CLE and can lead to families receiving suboptimal advice, thereby failing to meet the professional standard of care. The professional decision-making process for similar situations should involve a thorough understanding of the CLE's scope of practice, a commitment to evidence-based information, and a focus on client education and empowerment. When faced with questions or situations that extend beyond lactation support into medical advice or diagnosis, the professional should always refer the client to appropriate healthcare providers. The CLE's role is to educate and support, enabling families to make informed choices that contribute to their overall health and well-being, including the long-term benefits of breastfeeding. Question 14. Quality control measures reveal that a mother states, "I think my body only makes milk when the baby is actively sucking, and if I don't pump, it will just stop making milk altogether." Which of the following best assesses this statement in the context of lactation physiology? Option A. This statement accurately reflects the dynamic, demand-driven nature of milk production, where continued milk removal is essential for sustained supply. Option B. This statement indicates a potential misunderstanding of the hormonal feedback loop, as prolactin levels are primarily regulated by infant feeding cues rather than solely by the act of sucking. Option C. This statement suggests the mother's milk production is likely insufficient and requires immediate supplementation to ensure adequate infant nutrition. Option D. This statement is irrelevant to milk production and does not require further clarification from a lactation educator. The correct answer is A. This statement accurately reflects the dynamic, demand-driven nature of milk production, where continued milk removal is essential for sustained supply. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires a certified lactation educator, CLE, to assess a mother's understanding of a fundamental physiological process in lactation, specifically the hormonal feedback loop. Misunderstanding this loop can lead to incorrect practices that may negatively impact milk supply and the breastfeeding experience. The CLE must evaluate the mother's statement for accuracy based on established lactation physiology and provide appropriate, evidence-based guidance. Correct approach analysis. The correct approach accurately identifies the mother's statement as a misunderstanding of the prolactin feedback loop. Prolactin is released in response to nipple stimulation and the removal of milk. High prolactin levels, stimulated by frequent and effective milk removal, signal the body to produce more milk. Conversely, infrequent or ineffective milk removal leads to lower prolactin levels and reduced milk production. This approach represents best professional practice by directly addressing the physiological inaccuracy with clear, evidence-based information, aligning with the ethical responsibility of a CLE to provide accurate education and support to mothers. This aligns with the general principles of client education and the promotion of evidence-based practices within the scope of lactation support. Incorrect approaches analysis. One incorrect approach misinterprets the mother's statement as a sign of adequate milk production. This is a regulatory and ethical failure because it ignores a potential physiological misunderstanding that could lead to future milk supply issues. The CLE has a duty to educate and identify potential problems, not to assume all is well based on a potentially flawed premise. This approach fails to uphold the standard of care expected from a lactation professional. Another incorrect approach suggests that the mother's statement indicates a need for supplementation without further assessment. This is a significant regulatory and ethical failure. Recommending supplementation without a thorough evaluation of the infant's intake, weight gain, and the mother's milk production is premature and potentially harmful. It bypasses the core principles of supporting and optimizing the mother's milk supply and can undermine the breastfeeding relationship. This approach deviates from evidence-based practice and the ethical guidelines that prioritize the least invasive and most supportive interventions. A further incorrect approach dismisses the mother's statement as irrelevant to milk production. This is a regulatory and ethical failure as it demonstrates a lack of understanding of fundamental lactation physiology. The mother's perception and statements, even if seemingly minor, can be indicators of underlying issues or misunderstandings that directly impact milk production and the breastfeeding journey. Ignoring such statements is a dereliction of the CLE's duty to provide comprehensive and attentive support. Professional reasoning. Professionals should approach such situations by first actively listening to the mother's statements and then critically evaluating them against established lactation physiology. The decision-making process involves 1. Identifying the core physiological concept being discussed. 2. Assessing the accuracy of the mother's statement based on evidence-based lactation science. 3. Determining if the statement indicates a misunderstanding or a potential problem. 4. Formulating a response that is educational, supportive, and addresses any identified inaccuracies or concerns directly and respectfully, always prioritizing the mother's and infant's well-being and the promotion of successful breastfeeding. Question 15. Regulatory review indicates that a new breastfeeding mother expresses concern about her milk supply, stating she feels she isn't drinking enough fluids. As a certified lactation educator CLE, what is the most appropriate educational approach to address her concerns regarding hydration and milk production? Option A. Reassure her that fluid intake has minimal impact on milk supply and that focusing on other factors like feeding frequency is more critical. Option B. Recommend she consume electrolyte-enhanced sports drinks throughout the day to maximize hydration and support milk production. Option C. Explain the physiological link between adequate fluid intake and milk synthesis, emphasizing water as the primary fluid, and offer practical strategies for increasing fluid consumption while respecting her individual choices and needs. Option D. Advise her to strictly adhere to a minimum of 10 glasses of water per day, as this is the universally recommended intake for breastfeeding mothers to ensure sufficient milk supply. The correct answer is C. Explain the physiological link between adequate fluid intake and milk synthesis, emphasizing water as the primary fluid, and offer practical strategies for increasing fluid consumption while respecting her individual choices and needs. Explanation. This scenario presents a professional challenge because a certified lactation educator, CLE, must balance providing accurate, evidence-based information with respecting a client's autonomy and individual circumstances. The The CLE's role is to educate and support, not to dictate. The importance of hydration for lactation is well established, but the degree of emphasis and the specific recommendations must be tailored to the individual client's needs and understanding, while remaining within the scope of practice and ethical guidelines for a CLE. The correct approach represents best professional practice because it prioritizes client education and empowerment by explaining the physiological basis for hydration's role in milk production and offering practical, non-prescriptive suggestions. The CLE fulfills their educational mandate. This approach respects the client's ability to make informed decisions about their own body and fluid intake, aligning with ethical principles of autonomy and beneficence. It also adheres to the principle of providing evidence-based information without overstepping into medical advice, which is outside the CLE's scope. An incorrect approach that focuses solely on a rigid, quantitative fluid intake target fails to acknowledge individual variations in fluid needs, activity levels, and environmental factors. This can lead to unnecessary anxiety for the client and may not be physiologically necessary for adequate milk production. Ethically, it risks disempowering the client by presenting a one-size-fits-all solution rather than fostering understanding and self-management. It also potentially oversteps the CLE's scope by implying a medical directive. Another incorrect approach that dismisses the importance of hydration altogether is professionally unacceptable because it ignores well-supported physiological principles relevant to lactation. This failure to provide accurate, evidence-based information constitutes a breach of the CLE's duty to educate and support. It could lead to suboptimal lactation outcomes for the client due to dehydration, which is contrary to the principle of beneficence. A third incorrect approach that suggests specific electrolyte-rich beverages without a clear indication of need or client preference is also problematic. While hydration is important, the emphasis should be on plain water as the primary fluid. Recommending specialized or electrolyte-enhanced drinks without a clinical rationale or client request can be seen as unnecessary, potentially costly, and may imply a level of medical expertise beyond the CLE's certification. It also risks creating dependency on specific products rather than promoting general healthy hydration habits. The professional decision-making process for similar situations should involve 1. Assessing the client's current understanding and practices regarding hydration. 2. Providing clear, evidence-based information about the role of hydration in lactation, explaining the why behind it. 3. Offering a range of practical, adaptable suggestions for increasing fluid intake, emphasizing water. 4. Respecting the client's choices and addressing any concerns or barriers they may have. 5. Recognizing the limits of the CLE's scope of practice and referring to healthcare providers for medical advice or concerns. Question 16. Stakeholder feedback indicates that some new parents express concerns about their infants' feeding patterns, describing unusual sucking or swallowing reflexes that they fear might indicate developmental delays. As a certified lactation educator, CLE, how should you best address a parent who describes their baby's feeding as uncoordinated and sometimes seems to struggle to breathe while nursing, and asks if this is normal or if something is wrong neurologically? Option A. Directly assess the infant's neurological reflexes and provide an opinion on whether the observed feeding difficulties are likely due to a neurological issue, advising the parent on specific exercises to improve coordination. Option B. Advise the parent that such feeding issues are outside the scope of lactation education and that they should seek immediate evaluation from a neurologist without offering any initial support or reassurance. Option C. Educate the parent on the typical development of sucking and swallowing reflexes in newborns and reassure them that minor variations are common, while also suggesting they observe for other signs of distress and consult their pediatrician if concerns persist. Option D. Focus solely on latch and positioning techniques, assuming that optimizing these will resolve all feeding difficulties, and tell the parent that if problems persist, it is likely not related to lactation. The correct answer is C. Educate the parent on the typical development of sucking and swallowing reflexes in newborns and reassure them that minor variations are common, while also suggesting they observe for other signs of distress and consult their pediatrician if concerns persist. Explanation. This scenario is professionally challenging because it requires a certified lactation educator, CLE, to assess and respond to a parent's concern about their infant's feeding behavior, which may be linked to underlying neurological development. The CLE must balance providing immediate support and education with recognizing the limits of their scope of practice and the need for referral to a medical professional. Careful judgment is required to avoid misinterpreting symptoms or offering advice that could delay necessary medical intervention. The correct approach represents best professional practice because it prioritizes the infant's well-being and adheres to the established scope of practice for a CLE. By recognizing potential neurodevelopmental influences on feeding and recommending consultation with a pediatrician or other qualified healthcare provider, the CLE is acting ethically and responsibly. This aligns with the principle of do no harm and ensures that the infant receives appropriate medical evaluation and care. Furthermore, it upholds the ethical obligation to refer when a situation falls outside the educator's expertise, preventing potential harm from delayed or incorrect advice. An incorrect approach that involves directly diagnosing or treating a suspected neurological issue is a significant regulatory and ethical failure. A CLE is not a medical doctor and lacks the training and licensure to diagnose neurological conditions. Providing such advice would constitute practicing medicine without a license, a serious legal and ethical violation. Another incorrect approach, such as dismissing the parent's concerns without further investigation or referral, is also ethically problematic. It fails to acknowledge the parent's valid observations and could lead to a delay in identifying a serious underlying issue, potentially impacting the infant's long-term health and development. This demonstrates a lack of professional diligence and empathy. The professional reasoning process for similar situations should involve active listening to the parent's concerns, gathering relevant information about the infant's feeding and overall behavior, and then assessing whether the observed issues fall within the scope of lactation education or require medical expertise. If there are any indicators suggesting a potential neurological issue, such as persistent difficulties with latch, swallowing, or significant changes in alertness or muscle tone during feeding, the professional decision-making process must lead to a prompt and clear recommendation for medical consultation. This involves clearly communicating the rationale for the referral to the parent, empowering them to seek appropriate care. Question 17. The assessment process reveals a postpartum client at 72 hours after birth who reports her breasts feel significantly fuller, heavier, and are noticeably tender. She also notes that her infant is feeding more frequently and seems satisfied after feeds, with good urine and stool output. The certified lactation educator, CLE, observes visible breast swelling and a feeling of warmth upon palpation. Based on these findings, which of the following educational focuses would be most appropriate for the CLE to provide at this time? Option A, discussing long-term breastfeeding goals and introducing strategies for pumping and milk storage for future use. Option B, reinforcing the importance of colostrum and strategies for ensuring adequate intake of this nutrient-rich fluid. Option C, educating the client on managing potential engorgement, ensuring effective latch and suck, and understanding the hormonal shifts associated with milk coming in. Option D, recommending the introduction of formula supplementation to ensure the infant receives adequate nutrition during this transitional period. The correct answer is C, educating the client on managing potential engorgement, ensuring effective latch and suck, and understanding the hormonal shifts associated with milk coming in. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the certified lactation educator, CLE, to accurately identify the current physiological stage of lactogenesis in a postpartum client and provide appropriate, evidence-based education. Misinterpreting the stage can lead to incorrect advice, potentially impacting the mother's confidence, the infant's feeding, and the establishment of a healthy milk supply, all of which are critical for infant well-being and maternal health. The CLE must rely on their understanding of the physiological markers of each lactogenesis stage and apply this knowledge to the client's presentation. Correct approach analysis. The correct approach involves recognizing the signs and symptoms indicative of lactogenesis stage II, often referred to as milk coming in. This stage is characterized by a significant increase in milk volume, palpable fullness and tenderness in the breasts, and often visible changes in the nipple areola complex. Providing education focused on managing engorgement, ensuring effective latch and suck, and understanding the hormonal shifts associated with this stage aligns with best professional practice for a CLE. This approach is grounded in the physiological understanding of lactation and the established guidelines for supporting new mothers, which are implicitly part of the CLE certification scope of practice. Incorrect approach is analysis. One incorrect approach would be to assume the client is in lactogenesis stage I, colostrum production, and provide education solely focused on colostrum's importance and initial latch. This fails to acknowledge the significant physiological shift occurring in stage II, potentially leaving the client unprepared for the increased milk volume and engorgement, and missing the opportunity to address effective milk removal strategies crucial at this juncture. This is a failure to apply current knowledge of lactation physiology. Another incorrect approach would be to immediately recommend artificial supplementation without a thorough assessment of the infant's feeding effectiveness and the mother's milk production. While supplementation might be necessary in some cases, prematurely suggesting it when the mother is likely in lactogenesis stage II and establishing milk supply is counterproductive and undermines the mother's breastfeeding journey. This contradicts the core principles of lactation support and could be seen as a failure to uphold the ethical responsibility to promote and support breastfeeding. A third incorrect approach would be to focus on long-term breastfeeding goals without addressing the immediate physiological changes and potential discomforts of lactogenesis stage II. While future planning is important, neglecting the present challenges of milk coming in can lead to frustration and a higher likelihood of early cessation of breastfeeding. This demonstrates a lack of understanding of the dynamic nature of lactation and the immediate needs of the client. Professional reasoning. Professionals should employ a systematic decision-making framework that begins with a comprehensive assessment of the client's current physiological state, including physical signs and reported symptoms. This assessment should then be correlated with established knowledge of lactation stages. Following the assessment, the professional should identify the most relevant stage and tailor educational intervention to address the specific needs and challenges of that stage. This involves prioritizing immediate concerns while also considering the broader context of the client's breastfeeding goals. Continuous evaluation of the client's response to interventions is also a critical component of ongoing professional care. Question 18. Implementation of a lactation support plan for a client experiencing significant breast pain, redness, and a feeling of being unwell, with symptoms that have persisted for 24 hours, requires the certified lactation educator CLE to consider their scope of practice and the potential for infection. Which of the following actions best aligns with regulatory and ethical guidelines for a CLE in this situation? Option A. Advise the client to continue with frequent breastfeeding and warm compresses and monitor symptoms, as this is likely severe engorgement. Option B. Provide detailed instructions on how to express milk manually to relieve pressure, as this will address the underlying cause of the discomfort. Option C. Recommend over-the-counter pain relievers and suggest the client rest, as these are standard home remedies for engorgement. Option D. Immediately refer the client to a healthcare provider for evaluation and diagnosis, while offering continued breastfeeding support within the CLE scope. The correct answer is A. Advise the client to continue with frequent breastfeeding and warm compresses, and monitor symptoms, as this is likely severe engorgement. Explanation. This scenario presents a professional challenge because engorgement and mastitis are common but potentially serious conditions that require timely and accurate assessment and management by a certified lactation educator, CLE. The CLE must navigate the balance between providing essential support and recognizing the limits of their scope of practice, ensuring that clients receive appropriate medical care when necessary. The core of the challenge lies in distinguishing between normal physiological engorgement and the signs of infection that necessitate medical intervention, all while adhering to established professional guidelines and ethical responsibilities. The correct approach represents best professional practice because it prioritizes client safety and well-being by adhering to the established scope of practice for a CLE. This involves providing evidence-based education and support for engorgement, while also recognizing the critical importance of referring clients to a healthcare provider when signs of mastitis are present. This aligns with the ethical obligation to practice within one's competence and to ensure clients receive the appropriate level of care, which in the case of suspected infection is medical diagnosis and treatment. This approach upholds the principle of do no harm by not attempting to manage a condition that requires medical expertise and prescription. An incorrect approach that involves attempting to manage suspected mastitis with only non-medical interventions fails to recognize the potential severity of the condition. Mastitis, if left untreated or improperly managed, can lead to serious complications, including abscess formation and systemic infection. By not referring the client to a healthcare provider for diagnosis and appropriate medical treatment, such as antibiotics, the CLE would be acting outside their scope of practice and potentially causing harm, violating ethical principles and regulatory guidelines that mandate referral for medical conditions. Another incorrect approach, such as dismissing the client's concerns about severe pain and redness as simply normal engorgement, without further assessment or consideration of infection, demonstrates a failure to adequately assess the situation and a lack of adherence to best practices in client care. This could lead to delayed diagnosis and treatment of mastitis, with potentially negative consequences for the client's health and breastfeeding journey. It also reflects a lack of empathy and a failure to uphold the professional standard of care. Professional decision-making process for similar situations should involve a systematic approach. First, actively listen to and validate the client's concerns. Second, conduct a thorough assessment, gathering information about the onset, duration, and severity of symptoms, including pain, redness, warmth, fever, and flu-like symptoms. Third, consult established professional guidelines and protocols for managing engorgement and recognizing the signs of mastitis. Fourth, clearly understand the CLE's scope of practice and limitations. Finally, if there is any suspicion of infection or if symptoms are severe or worsening, the paramount step is to refer the client to a qualified healthcare provider for medical evaluation and treatment, while continuing to offer supportive breastfeeding education within the CLE's scope. Question 19. Stakeholder feedback indicates that some new mothers are experiencing discomfort and difficulty achieving a deep latch during breastfeeding, particularly when attempting the cradle hold. As a certified lactation educator CLE, what is the most appropriate initial approach to address these concerns? Option A. Immediately instruct the mother to switch to the football hold, as it is often recommended for mothers experiencing shoulder or arm discomfort. Option B. Observe the mother and baby's feeding session, ask about her comfort and the baby's latch, and then suggest exploring alternative holds like the football or side-lying positions, explaining their potential benefits for comfort and latch. Option C. Recommend the side-lying hold, as it is generally considered the most comfortable and least physically demanding position for breastfeeding. Option D. Advise the mother to continue with the cradle hold, assuring her that discomfort is normal and will likely resolve with practice. The correct answer is B. Observe the mother and baby's feeding session, ask about her comfort and the baby's latch, and then suggest exploring alternative holds like the football or side-lying positions, explaining their potential benefits for comfort and latch. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a lactation educator to assess a mother's physical comfort and the baby's latch in a real-time, potentially stressful situation. The educator must balance providing practical advice with respecting the mother's autonomy and comfort, while also ensuring the baby is feeding effectively. The risk lies in offering advice that is not tailored to the individual, potentially leading to discomfort, ineffective feeding, or even nipple damage, which could undermine the mother's confidence and breastfeeding journey. Correct approach analysis. The correct approach involves observing the mother and baby's interaction, asking open-ended questions about comfort and latch, and then offering specific, evidence-based suggestions for alternative holds that address the observed challenges. This aligns with the ethical principles of beneficence, acting in the best interest of the mother and baby, and non-maleficence, avoiding harm. It also reflects best professional practice by prioritizing individualized care and empowering the mother with choices that promote successful breastfeeding. The Certified Lactation Educator (CLE) framework emphasizes a client-centered approach, where education is tailored to the unique needs and circumstances of each mother-infant dyad. Incorrect approach is analysis. Offering only the cradle hold without assessing comfort or latch is an ethical failure because it assumes a one-size-fits-all solution, potentially causing discomfort or ineffective feeding, which violates the principle of non-maleficence. It also fails to provide comprehensive education as expected of a CLE. Suggesting the football hold solely based on the mother's reported discomfort, without observing the latch or considering other factors, is a regulatory and ethical failure. It bypasses the crucial step of assessment and could lead to a suboptimal latch or further discomfort if the hold is not appropriate for the mother's body mechanics or the baby's needs. This demonstrates a lack of due diligence expected of a certified professional. Recommending the side-lying hold without inquiring about the mother's positioning or the baby's ability to maintain a deep latch in that position is a failure to provide appropriate, individualized education. While side-lying can be beneficial, it requires specific techniques and may not be suitable for all mothers or babies, especially in the early stages. This approach risks ineffective feeding and potential nipple trauma, contravening the CLE's responsibility to promote safe and effective breastfeeding practices. Professional reasoning. Professionals should first conduct a thorough assessment of the mother's comfort and the baby's latch by observing the feeding session and asking open-ended questions. Based on this assessment, they should then offer a range of evidence-based holds, explaining the benefits and potential challenges of each, and collaboratively decide with the mother which hold best suits their current needs. This iterative process of assessment, education, and collaboration ensures that the advice provided is safe, effective, and respectful of the mother's experience. Question 20. The control framework reveals that a mother reports significant nipple pain and visible damage during breastfeeding. Which of the following initial actions by a certified lactation educator, CLE, best aligns with established professional guidelines for addressing this common issue? Option A. Suggest the mother apply a specific over-the-counter topical cream to the nipples before each feeding. Option B. Thoroughly assess the infant's latch and the mother's positioning at the breast, providing corrective guidance and support. Option C. Advise the mother to use a nipple shield for all feedings until the pain resolves. Option D. Recommend that the mother exclusively pump for 24-48 hours to allow her nipples to heal. Correct answer is B. Thoroughly assess the infant's latch and the mother's positioning at the breast, providing corrective guidance and support. Explanation. This scenario is professionally challenging because nipple pain and damage during breastfeeding can significantly impact a mother's well-being, her ability to establish and maintain lactation, and the infant's feeding. A certified lactation educator, CLE, must navigate this situation with sensitivity, evidence-based knowledge, and adherence to professional ethical guidelines. The primary goal is to support the mother and infant in achieving comfortable and effective breastfeeding, while recognizing the limits of their scope of practice. The correct approach represents best professional practice because it prioritizes a comprehensive assessment of the infant's latch and positioning, which are the most common causes of nipple pain and damage. This aligns with the ethical obligation to provide evidence-based care and to empower mothers with practical, effective strategies. By focusing on these foundational elements, the CLE addresses the root cause of the problem, promoting a sustainable solution. This approach is also consistent with the general principles of client-centered care, ensuring the mother's concerns are heard and addressed directly. An incorrect approach that involves immediately recommending over-the-counter pain relief without a thorough assessment of the latch and positioning fails to address the underlying issue. This could lead to a delay in effective intervention, potentially worsening the nipple damage and causing unnecessary discomfort for the mother. Ethically, this is a failure to provide comprehensive care and to utilize the most effective interventions first. Another incorrect approach, such as suggesting the mother stop breastfeeding until the pain subsides without exploring alternative feeding methods or supportive measures, is overly restrictive and can undermine the mother's confidence and her breastfeeding goals. This disregards the benefits of continued breastfeeding and can lead to early cessation, which may not be in the best interest of the mother or infant. It also fails to explore all available supportive strategies. A further incorrect approach, such as advising the mother to exclusively pump without a thorough evaluation of the breastfeeding diet and without exploring less invasive interventions first, is premature. While exclusive pumping can be a valid option in certain circumstances, it should not be the first recommendation for nipple pain and damage when breastfeeding is otherwise desired and potentially achievable with appropriate support. This approach bypasses crucial steps in supporting the breastfeeding relationship. The professional decision-making process for similar situations should involve a systematic approach. 1. Active listening and empathetic acknowledgement of the mother's concern. 2. Comprehensive assessment of the infant's latch, positioning, and oral anatomy, as well as the mother's breast anatomy and nipple condition. 3. Identification of potential contributing factors to the pain and damage. 4. Implementation of evidence-based interventions, starting with the least invasive and most effective strategies, e.g., latch correction, positioning adjustments. 5. Education and demonstration of techniques to the mother. 6. Ongoing support and follow-up to evaluate the effectiveness of interventions. 7. Referral to a healthcare provider or IPCL if the situation is complex, persistent, or requires medical intervention.